Finding someone that understands you is hard because you're human, and there's a lot of different humans out there. eHarmony helps you find someone you can be yourself with. You think no one would understand mourning a plant like it's a loved one, or singing made-up songs to your dog, but that's the type of person eHarmony helps you find. Someone who makes you feel seen, heard, and understood. Get started today on eHarmony. Get who gets you.
So that guy I met on eHarmony, yeah, we're out together last night and I stepped off a curb and snap, heel breaks right off my shoe.
Oh no.
So I say, hell with it, take them off so I'm barefoot, and you'll never guess.
What?
He leans over, takes off his shoes and socks, and now we're both...
You're joking.
Amazing, right?
At eHarmony, you'll find someone you can be yourself with. Get who gets you on eHarmony. Sign up for eHarmony today.
There's so many changes that can happen as we get older and get closer to that menopause transition, one of which is vaginal changes. It's pretty common to have vaginal dryness, which can lead to painful sex and just general discomfort. There could be vaginal and clitoral atrophy due to decrease in blood flow to the area. And the fact that it happens, let alone what to do about it, doesn't get talked about all that much, so we're going to dive into that today. You're listening to the Health Courage Collective podcast, episode 166, Vaginal Health as You Age with Lana Kerr. Welcome to the Health Courage Collective podcast, the show for women who are too busy to slog through hours of generalized, inapplicable, and often contradictory health information, but too smart to ignore that a few minutes of focused attention now can prevent years of suffering in the future. I'm your host, Christina Hackett, a pharmacist who doesn't want you to live on prescriptions, a certified coach specifically trained to maximize your potential, and a compulsive learner obsessed with preventative, cutting-edge, holistic, and integrative medicine. I'm on a mission to increase your physical and mental resilience so you can fearlessly look forward to your next 40-plus limitless years. Your time is now. Let's go. Thank you so much for being here today. This is so fun.
Yes. Thank you for having me.
Yeah, I'm glad to have you. So I'll have told the audience your bio already before they get to this part in the podcast, but it said that you love advocating for women's health, especially during the menopause transition. And I was just wondering if you could tell me what you love about that.
Well, I just think that the subject is not discussed often enough. I mean, obviously, right in the last year, it's been an onslaught of information on social media or on the news on menopause, which is a great relief. Mm-hmm. I know that when I was approaching menopause, I'm in menopause right now, there was very little information. I didn't even know who to ask information about this. And even when you talk to your GYN, it was just so cryptic, mm-hmm. And it was almost like you're at the end of your life, which I love this time of my life. So I like to share information with women to show how they can get into this awesome phase of life with confidence and with just with a level of control and power.
Yeah, awesome. I love that too. So I don't know if he told you about me, but I'm a pharmacist for my job, but then I also am a coach, kind of like you. And my whole thing is wanting to put more years lived in good health in people's future, because I watch in the pharmacy everybody kind of slowly deteriorating and getting decrepit, and I don't think it has to be that way. So
exactly.
And I feel like women have so much to offer. Like there's so many problems in the world and we can step up and solve it, but it's so much harder when you're dealing with health issues all the time. So
yes, I totally agree.
Yeah, so that's awesome that you love that. So when I was reading about it, my first question is, I had no idea that CO2 helped your skin, that carbon dioxide was good for your skin. So I was wondering what carboxy therapy is. And it said that you invented this CO2 lift gel that I assume is for your face.
Yes.
And so I'm just wondering how carbon dioxide helps your skin.
Okay. Well, carboxy therapy actually is a very old form of therapy. It dated back to when the samurai warriors would bathe in the carbonic hot springs in Japan. Mm. The French also had it, but when they would fight in battle, they would go into these hot springs and it would regenerate their wounds very quickly. Then fast forward into the early 1900s, the French developed a injectable version where they would inject CO2 gas into the skin. So what happens naturally when that happens is that it triggers the body's a response so that the hemoglobin will unload oxygen and pick up the CO2 gas. So the area is filled with oxygen-rich blood, increased blood supply, angiogenesis, neoangiogenesis. So it's a very therapeutic treatment, and it's a very natural way to quickly regenerate the body. Also, too, because of the influx of oxygen-rich blood, hydration increases. So the gel version was developed in Japan, and we have the exclusive rights to that technology. And the gel is a superior version because there's no downtime, there's no pain involved, as well as the areas and indications are more because of the flexibility of a gel.
Right.
It started with, when we started, and we've been really invested in many clinical studies which have been published. We have done diabetic ulcer studies. We showed that we can, even in the pilot, we showed that we could regenerate a non-healing diabetic ulcer in as little as 8 days with 4 applications of the CO2 lift. We did a larger body. The wounds we're currently doing a venous ulcer study, but even in the diabetic ulcer study, there were severe wounds. They were non-healing for 8 to 12 months. And the gel was applied 3 times a week for 4 weeks, and the wounds closed.
Wow.
With the application of a gel that the person could actually do at home. We've done studies with hydration studies. In fact, it's the only product that increases hydration over 117% after 1 application. So usually when there's a wound healing component, there's an aesthetic component. Because aging happens when the skin is slow to regenerate. So then you develop fine lines and wrinkles. CO2 lift really refreshes your skin. I always compare it to a grape raisin analogy. The grape is full of just plump and no lines on it, juicy. And then it turns into this raisin. And the difference is the lack of water content. And that's pretty much what happens to us all over our body. We start off with this grape, and then we turn into this raisin. Fortunately, we can delay the process or even reverse the process with the technology that's available.
That's awesome. Okay. And I've heard of CO2 lasers. Do they use CO2 to get the skin to heal in a similar way? Okay.
Yes, it has, but it's different. It's the laser, the energy-based device is different. We're really just, so we're doing with the laser or energy-based device is control damage to the tissue to then elicit a healing response for the body. When you put CO2 gas into the skin, you're doing the same process without damage to the body. Because when you insert CO2, and what we've shown, we've looked at the skin when we've applied the CO2 gel and looked with a video capillary machine and seen what is happening under the skin. It's increasing microcirculation over 28%. So it has really many indications. From wound healing to aesthetic. So it can be used in the medical application it treats the skin barrier for eczema, psoriasis. It's for plastic surgeons use it for healing. When they're doing, liposuction where you're bruising, it reduces the bruising, to 7 days. The swelling gets rid of inflammation. They put it on flaps. They can put it after laser to help also to quickly heal the skin and rebuild the skin barrier.
Awesome. Interesting. And it's all because you've got all this oxygen-rich blood coming there to get the CO2 and pull it in. Interesting. Okay. Cool.
So and what happens is too, it doesn't just last because you keep the gel on the skin for 45 minutes, but that action doesn't just last for 45 minutes. It continues after, and every time you do it, it has an exponential benefit. So we're currently doing a fusion study right now, which I'm really excited about because what we're doing is actually measuring how far reaching it is, and then also how long it stays in the system. Because what we've seen is that the action continues even with the removal of the gel.
Yeah, sounds
really great. I know there's lots of people I see in the pharmacy who have those wounds that won't heal, and they're getting all their gel dressings and all the things, and it's just not working.
Yeah.
So yeah, awesome. Okay, and so we turn from a grape to a raisin as we get older, or that's kind of the thing that sort of starts to happen. What about like as far as vaginal dryness goes at the menopause transition? Is it similar to that?
Yeah, I always say that, aging affects more than just the skin on our face, neck, and hands.
Right.
But there are actually three components to great sexual satisfaction. You have the muscle component, which that tightness that you feel when you can grab something. You can there is the vulva, which has the clitoris, which has double the nerve endings of the penis. The only sole purpose of the clitoris is for enjoyment, and that requires healthy blood supply for it to operate optimally.
Okay.
And our blood supply starts slowing down when we're in our 20s. So if we do nothing about it by the time we're in our 30s, 40s, it starts to get smaller or atrophy. And then it takes a longer time for a woman to reach orgasm.
Okay.
Then the third component is the skin in the vagina, the vaginal tissue. That's tissue is as thin as the skin under our eyes. So if we think about our eyes, usually it shows age faster. It gets thinner, drier, very similar to the vagina, thinner, drier. So eventually you don't lubricate the same, and then eventually it becomes dry and painful. So leading to painful sex.
Right.
So CO2 lift has been really, and this is it was usually when I come upon things, it's something that affects me. When I was 47, I started noticing, and I was on bioidentical. So I believe in it, and I think women should think about using that as a way to combat the symptoms of menopause. But even with that, I noticed a difference in the quality of intimacy. And going to my gynecologist and being educated in what really happens down there. I went to one of our medical directors, who was a cosmetic gynecologist, and asked, what do you think about using the CO2 lift for there? Because we had just completed our wound healing study. And I'm thinking, if you look at diabetics, the problem with them, why they can't heal on their extremities, is circulation. It's a lack of blood flow. So if the clitoris needs blood flow, and that's a fast way to do it, wouldn't that be helpful? Then the skin in the vaginal tissue, the tissue, to get that thick and healthy again. We can't do anything about the tissue, about the muscle. Many women often feel tighter, but it's just that the tissue is thicker. Anyway, we started with a pilot study. We did a double-blind study. And for your listeners, what that means is that the patients who are using the product, they don't know if they're getting the actual product or they're getting a placebo, which we used an ultrasound gel. As well as the investigator doesn't know which one we're using. And women that used the ultrasound gel showed no changes in sexual function. 100% of the women that use a CO2 lift showed significant change in arousal, desire, lubrication, orgasm, sensitivity. So we were pretty excited. We've repeated that study twice with just larger amount of women. We just completed another one, 50 women, and we added stress incontinence, where women would, they cough and pee. Added that to an indication. It was just phenomenal. The biopsies that were taken 10 treatments later, that's after 2 weeks, the tissue from those women it was severe atrophy, showed life and healthy tissue. So that was very exciting. And we launched that in a soft launch in 2018, and then a larger than the official one in 2020. And we have hundreds and hundreds of testimonials from all ages of women, not only women in perimenopausal, but women who have stress, just from stressful situations, that area is affected. After childbirth, that area is affected. Breastfeeding affects that area. So I think just really excited that it helps to improve the quality of life for women.
My pharmacy, for whatever reason, we compound, so we do some kind of weird stuff. Like we do a lot of bioidentical hormones, but we'll have doctors that like invent things and have us make them. And so we have this doctor who's like super into vulvodynia. So we usually do estrogen type things, but I'm thinking this probably would help them if it's just like painful and irritated all the time. Sounds like
vulvodynia is more like And I think it has a lot more psychological component. It's when you
Mhm.
just tighten up, when you see, and
Mhm.
I think if you think about it, if you get something that the woman believes that can help to make sex more pleasurable, they'll just be more relaxed. But this has been very effective also for like lichen sclerosis, which really the
Okay.
only solution currently is corticosteroids, or they'll use PRP for this. But this has been very effective for treating biopsied lichen.
Interesting. Okay. Yeah, because this doctor, he'll have us do estrogen and also steroids usually for them, the vulvodynia people.
Yeah,
So,
and if you think about steroid, it's going to create a problem. The
yeah.
continuous of it is going to thin the tissue, going to dry out
Yep.
the tissue. So it's like, so
hmm
to have something that's hormone free,
hmm
that has no contraindications, that is really a natural response to the body by introducing CO2. It's really a great solution for women, and something that
Yeah.
you can do in the lives of your home, that
Right.
you can control, that's
hmm
cost effective. It's
Yeah.
just, yeah.
Yeah, that's awesome. So yeah, one of the things I was going to ask you about was the stress incontinence. So you already talked about that because I know it's like a lot of people will do Kegel exercises for the muscles, and sometimes that helps with incontinence stuff, but not always. So, but it sounds like this helps with that too. So that's super interesting.
Because it's treating the tissue. But now, for instance, the muscle, remember I talked about, that's like, I recently, talking about as recent as 3 weeks ago, this Thursday will make 3 weeks, I did vaginoplasty. So a vaginoplasty is like a facelift, but it's for your vagina. So
hmm
it's not for the vulva. So that's like a labiaplasty. This is not for aesthetic reasons, for functionality. So why did I do
Yeah.
it? I did it because as you get older, so I'm 53, going to be 54. And as you get older, you can do, even if you look at the skin on your face, you can do as much, RF, you can do as much CO2. I mean, you could do as many things to regenerate that tissue, but eventually the muscle just gets weaker
hmm
and you have to kind of pull it in. So it's the same thing with vagina. So
Okay.
I'm excited that I'll have like a 21-year-old vagina soon. The result. So it's in the healing process right now. We've used the CO2 Live V to help heal because generally when you
Yeah.
do that procedure, which is about a 3.5 to 4 hour procedure, it's not general anesthesia. And you have to go to a competent doctor who has done many of them because you don't want
Yeah.
anything. Can you imagine?
Right.
And I flew, and I'm in Florida, as I mentioned to you before. I flew to Sacramento and saw Dr. Reed, who's excellent. And we did it. And the CO2 Live V helps to heal quickly. So generally,
Mm.
it's an 8-week downtime. So I'm expecting more like a 5-week downtime,
Yeah.
which so I'm looking forward to seeing him again and then get a clearance. But I've been healing very well. There's been no swelling, there's no inflammation because again, the CO2 lift helps to get rid of that and
Yeah.
help.
Cool. Do you think there's anything that can be done to prevent? So we know that it's common for people to have vaginal dryness or like the atrophy and that kind of thing. Is there anything to be done to prevent those or delay those from happening?
Yes, the CO2 lift is one of the modalities that I use, and that
Okay.
is proven to delay it. You look into different countries or different nationalities that seem to look young for a very long time. And, genetics obviously has a part to play in that, but it's a lot to do with how early you start to take care of it. So look
Yeah.
in Asian countries and Korea, they start from they're 15 years old. They start taking care of their skin like how we
Mhm.
start in our 30s. I mean, I think it has
Yeah.
improved now. I mean, I certainly started in my late 30s, but I noticed that so many more young because of TikTok and all the talking about skincare. A lot of younger people are starting, which is a great thing. So even vaginal dryness,
hmm
which is or all the symptoms of GSM, genitalia syndrome of menopause, which
hmm
can start from as early as in your 30s. You can stave those off because even though your hormones change, and I'm an advocate of bioidenticals, for that area, you can keep that skin reconditioned and keep it conditioned so it prevents it. So I
Okay.
advocate for women to start just like they start with their skincare. If I was to go back to my younger self, I would say start from 15
Mhm.
because it almost kind of frees your skin.
Yeah.
And that's a good way to stay both, and your whole body. So, we're not dissecting over the face, because I'm telling you, as you get older, then you say, oh, I didn't do the neck. And then you say, the hands, and then you say your stomach, and then your knees. Your whole body needs to be treated and conditioned so that you can look youthful all over and feel youthful.
Right. Yeah. Okay. Yeah, that's kind of what I was wondering is this something somebody should wait till they have vaginal dryness and problems to start using, or if they start using it when they feel pretty okay, is it going to
Yes.
delay that? That sounds
Yes.
like it does.
And also to remember, it's blood flow.
Yeah.
And it's going to help to improve the quality of orgasms, which is very good for us as women. It helps us with our stress level. It helps us with our immune system.
Mhm.
It helps us to connect not only with our partners, but with ourselves. So I feel that, and then as women, we have very few sexual cues, right? So to start really taking care of that area, it kind of gives us it's like almost an empowering situation for us. We feel in control. Why are we only taking care of the skin here? We're putting lotion and we need to take care of that area, keep that area healthy.
Yeah.
And so, yes, I would say that I would, for certainly at least in our 20s. I mean, I know people who are using it. Some doctors are recommending it for people with very bad period pain. So younger girls.
Mm.
So, because again, it's about healthy blood flow.
Mm.
So, and
Interesting.
keeping pH balance, which is important too. So, yeah, I would say there's no age restriction on it. There's nothing that can happen. There are no contraindications because, again, it's CO2 gas.
Yeah. And if it's helping with pH balance, that would probably lower your risk of different infections and things.
Exactly.
Yeah.
Yeah. So that's
Awesome.
really the difference between the CO2 lift regular that you use on the rest of your body and the CO2 lift V. The pH of that is different, as well as a
Okay.
little bit of other component to help with any kind of inflammatory issues down there. But the CO2 lift can not only help with women's genitals, which we, in this case, CO2 lift V, but men are using the CO2 lift to help to improve sexual function for them, because again, it's blood flow. So we're
Right.
just in the process, a urologist in Spain is doing a larger study
Hmm.
on the CO2 lift for men. But we did a shorter study, a pilot study in Canada, and they found that after 5 applications, it improved the SHIM score, the sexual health index for men, 5 to 12 points. And then, of course, it's making that skin smoother. It's making the testes nicer, not like shrivel up like that raisin again. So it's great for both sexes. I mean,
Oh,
I focus
interesting.
on women just because women have, we're like 25 years behind,
Yeah.
in terms of developing things that are going to help us in that area of our life to stay youthful and operate with youthful functionality.
Mhm. For sure. Cool. Yeah, I was wondering about that too. I was like, okay, so if this helps with blood flow, could men use it too? So it sounds like the answer is yes. What would you say are the benefits of vaginal rejuvenation, either the surgery that you were talking about or just making sure that you're keeping that tissue young? So obviously sexual pleasure and avoiding all the pain that can come when you have vaginal dryness, but are there other benefits that you see in women's lives?
Oh yeah, I think it helps with relationships. You're thinking about one of the big contributors to divorce later on is the lack of sexual intimacy and the lack of desire. And one of the things that we've seen in our double-blind study is that arousal and desire improved.
Hmm.
Only with the section of women that were using the CO2 lifts. And you wonder why. Well, again, it's blood flow. So I think, for instance, relationships improve, all quality of life improves, just general well-being and emotional well-being improve. Because I think that, a study was done that showed that how a person perceives themselves in the mirror and is how generally they'll act. So if you look young to yourself, you're going to act younger.
Hmm.
And then I'm not talking about acting immature, but just acting more youthful. And
Right.
even with, in particular with vulva vaginal rejuvenation, I think it has some other benefits, aesthetic component. You want it, many women shave so that it looks nicer. They're wearing yoga pants, so it looks nicer in your yoga pants. it's more confidence. And I think when women feel confident, they're just better people, better their roles.
Yeah, I love that. I do think that confident women are better people and they're ready to go out and help somebody else who needs help. So that's cool. So how often, how often do you put this product on? Is it something you do every day?
Great question. So for the face, what it has been shown from our studies is that if you do a skin reboot, is 6 within a month. So you would do maybe 3 the first week and then maybe 1 a week after that. So
Okay.
for the month. And then you would a skin reboot, all the markers of youth in terms of skin. So you're talking about like luminosity, reduction in wrinkles, radiance, elasticity, hydration. Well, we talked about over 117% increase in hydration, but in all those other double-digit improvements within 6 treatments. Then you would just maintain it by doing once a month. And you still, and even in the study, it showed an increase from 26 to 28% after 3 weeks of non-use. So it's a monthly treatment for the skin. For the vaginal, it's a series of 10 treatments within 2 weeks. And then, so it's applied similar to a tampon. And then the rest outside, you put on a panty liner. You can leave it on for the 45 minutes, or you can just go to sleep with it on. And then you wake up, when you wake up, you pee it out into the toilet, and then you just rinse off in the shower. And then after you finish the 10, then again, it's monthly treatments to maintain.
And it sounds like, because it seems like almost too good to be true, you just put on this gel and it's non-irritating and you only have to do it once a month.
Yes.
Yeah,
And
that's awesome.
it's a fun. I mean, I'm always amazed how many people even post on it. We've had people like, I mean, a lot of celebrities will post the gel on their face. Like Christy Teigen has posted and tagged us in her account. Hadid tagged. I mean, I'm like, and people love to put it on and show it on their face, and the peel off is actually fun. But yeah, it's a very comfortable treatment. It's very cooling on the skin. It's the same with the vulva vaginal. It's very cool. It's a nice treatment for yourself.
Okay. Yeah. And how would you say it's different? Well, I guess we probably kind of talked about it, but like sometimes you see like the O shot advertised and those kind of things.
Yeah.
Does it have similar benefits? How would you compare it to something like that?
So the O shot or PRP shot, that's what it's doing. They're drawing your blood, spinning it, taking out the platelets, and they're putting it in they will re-inject it in different parts of the vulva, and then inside of the urethra, by the clitoris. And it's supposed to, it's a biostimulator. That's what it is.
Yeah.
CO2 lift is also a biostimulator or a bioregenerator because it's allowing your body to regenerate itself. The thing with I feel that the superiority, some people don't want to do that, don't want to go into an office and have to have someone open your legs and take that in. And it takes time. CO2 lift is almost like it's jet fuel. So even if you use other biostimulators, some people use exosomes, some people use PRP. This is like it starts it very quickly. CO2 is the jet fuel for any procedure. Also, it can be done as a standalone, so you don't have to use it in conjunction with that, and you can do it on your own. In addition to that, as people get older, the quality of your platelets diminishes. So if you're doing plasma shot when you're in your 30s, it's going to be a very different plasma shot that you're doing in your 50s because the number and the quality of platelets changes. So this kind of standardizes it, and it's, I think, less expensive than even doing a PRP or O shot.
Yeah, and much less painful, I would assume.
Yes, exactly. Something that you can do at home and you have control over it. Some people, though, do it in conjunction. So I like double therapies or, things done together, using other modalities. It has a way of improving the benefit exponentially. So some people do them in conjunction, or they'll do laser and they'll use a CO2 lift or any kind of RF energy-based device. There, whether it be for their skin on their face or the skin down there, their intimate skin, and then they use it in conjunction with the CO2 lift.
Okay. Yeah. And as far as other home treatments would go, I mean, you could get a prescription for vaginal estrogen. And then there's like lubricants. Is there anything else that people use that would be an alternative to this?
I mean, I've seen people use coconut oil. I mean,
Right.
CO2 lift, the difference is that we're not a lubricant. It's not something you do prior to sex. It's actually a
Right.
treatment.
Right.
So, I think that a lot of the HA solutions that people advertise are just nothing but an expensive lube, because it's not that the molecules are too big to actually penetrate. It's not doing anything long term for you. I mean, estrogen, I think estradiol, or those are good. I mean, but how can you use it forever? Some people may not want to, and so this is something that you are actually doing. That's again a treatment that you can maintain with a monthly. So you still need lubrication. I think that one of the benefits of CO2 lift, it gives not only increased lubrication, but sustained lubrication. You could have 3 hours of sex and still have your lubrication going.
Okay. Yeah. Interesting. Are there any like apprehensions or things that you've heard of that people are worried about when they hear about vaginal rejuvenation that kind of keeps them away from it?
Yeah, I mean, I think you hear, from don't put anything up there.
Yeah.
I mean, and I agree. You shouldn't. I mean, the things that people put up there and the soap and all, but this is a treatment, so it's different. I think people need to be open-minded as to the fact that technology just changed. I think 25 years ago, and you go to a man and you say, guess what? You can get a harder, longer erection. They'll say, first of all, they're like, I'm good. But people don't hesitate to do that. You know what I'm saying?
Yeah.
We're just 25 years behind the scope. So it's like, you can have sustained lubrication, increased orgasm, insensitive arousal all the way until you choose not to. No, I'm good. That's what, you know what I'm saying?
Okay.
So I think, first of all, it's a lack of education. Or the misinformation that we've heard, even for bioidenticals. So many women today are just not up to speed with most of the current data.
Yeah.
Are hurting themselves by not at least investigating it. It's the same thing for vulva vaginal rejuvenation. And some people are opposed to that word rejuvenation. Well, think of restoration. I mean, whatever the terminology. I mean, to me, I don't see the big deal. What's wrong with rejuvenation? I don't see the negativity in there. I don't see it. I think that we avail ourselves to new technology for so many things. Sunscreen, that wasn't really talked about maybe 20 years ago. Everybody's talking about sunscreen.
Yeah.
Or as one of the best things to rejuvenate and to prevent or prejuvenate. Wrong with that. You know what I'm saying? So I think it's a thing. I think that we as women have just had a history of it's almost like we need permission to enjoy this area of our life. And it's not just about sexual enjoyment. It's just about feeling good in every part of our body.
Yeah. Okay. Yeah. So I didn't even think about like all those scammy emails that they used to send out to men. Like maybe that's how we got this, like, leave me alone kind of a thing. But
Yes.
Okay. So indications that the CO2 lift V might be for you would just be that you're a woman.
Yes, that you just want, just like you have skin, you want to take care of it, so that's because we know what it's delaying. And then at the same time, if you're just hearing about it now and you're facing these symptoms, this is something that can help reverse it for you.
Right. Okay. So reversing is huge. If you're having problems, this can be like a huge burden that it takes away from you.
Yes.
But also preventing those from ever happening in the first place.
Yes. And then you don't have to do as many when you're younger. Well, it depends. I don't like to say that because some people are younger and they have PCOS. They have to do the 10. But if you're generally in a healthy condition and you start early, I mean, you can do a loading dose of 5. It's close to 10, and then once every quarter.
Okay.
So you see, because you have control over those things.
And you'll still see benefits. That's awesome.
Yes.
So why do you think, I mean, other than like patriarchal stuff and whatever, why do you think that more people don't know about this yet?
I think you answered it. I think that that's the reason. I think there's so much shame when it comes to talking about women's genitals, women's pleasure. I think you're either labeled as something negative, I mean, in fact, I was on another podcast, and a physician, cosmetic gynecologist was on, and I don't know if I'm even saying the right word, so you may know this, but the term that was used for vagina was pudendum, which is the Latin word. It means shame.
Oh,
So you think about that. If that's the word, it comes from shame. I mean, even in Spanish, when someone's pregnant, is embarazado. Why?
mm.
It's like, why would that be the name for that?
Yeah,
The history where it's coming, the psychological history that we have, and we just don't, and then, so I think that is part of it, which I'm glad it's changing, because
yeah.
here, look at your podcast, you're talking about it, where, I mean, you can just go back 4 years ago, people weren't talking about it,
Mm-hmm.
and then they were talking about it after dark. Why should your children not know what their genitals are and know that it's sacred and needs to be taken care of?
Yeah.
My children I have two boys, they're grown now, 23 and 21, but my children know when my door is closed, it's your father and I are playing, because that's how we stay together. And you're not invited. So, so what's the shame in that? It's
Yeah.
the understanding of, what takes place, because if it didn't, none of us would be around, right? So I think that's the reason. Lack of education. I think women think that when you have doing something about there's a problem with you. No, we're all getting older, and
Mm.
nothing is wrong with aging.
Right.
But we want to age so that we have youthful functionality of ourselves.
Yeah. Awesome. Okay. Have you seen any other like problems or challenges trying to spread the message?
Well, I think things have been getting better again, just
Okay,
because
good.
there's more information, or there's more people willing to talk about it. I still think we have a ways to go, but we're definitely on the right path. Just more studies need to be done with women. But the challenge, I think a lot of the challenges that we faced in the very beginning we're kind of worked through it, and so now it's just a matter of take time, spreading that information, spreading
Mm-hmm.
the solution.
Yeah. Yeah. Good for you. I think it's something that everybody needs to know is an option, even if they choose not to try it. But it seems like super safe thing to try. So why not?
Yeah.
Yeah. Anything else that you want to say about it that I missed?
I think you did so good at covering all of this. My last thing for women is just always to think about that area of your life. I mean, we as women, we spend time really just taking care of everybody else. I
Yeah.
think we need to take care of ourselves too. We need to, if I define self-love, and everybody's talking about that, I would define it as just treating yourself with the same love and respect that you would a friend. You would take care of your friend. You would speak kindly to your friend, speak kindly to yourself, take care of yourself. The
Yeah.
importance of intimacy I think it's important.
Yeah.
And especially in your relationship with your partner, yourself. So take time to understand what that means. A lot of, even after we take care of our bodies, a lot for women, especially sexually, is our brains, the way we think.
Yeah.
So we want to use our imagination for that area too. We need to use our imagination in all areas of our life. In our business, we need to use our imagination to how to keep things fresh and exciting. We
Mhm.
need to do it when we cook for our families. Not same old dry, whatever, every day is going to be boring. We need to use our imagination in our relationship too.
Yeah. Awesome. I love that. Okay. All right. Well, thanks so much. So if people want to learn about, like, read more about it or look up how do they even buy this, where should they go?
So they can definitely check with their provider, their skincare provider,
Okay.
they can ask their gynecologist about it, where they ever go to take care of their skin. Also, they can go to co2lift.com. They
Okay.
can get information on it. They can shop for the CO2 Lift V there. And we're offering a code, Christina10. for 10% off. So they would just, if they had anything on the site they want to try, put it in their cart, and then at the end enter the discount code and get 10% off to try that. But our social media handles are good. My personal one, the Lana Kerr, many people after these type of podcasts, they DM me and I'm very good about responding. As well as the company Instagram, CO2 Lift, and at CO2 Lift V. And again, just ask your questions or just email us when you go to our website, support and email there. Also, we have a great support team as well.
Okay. Awesome. Yeah. And we'll send people there to pick, and that's awesome that they get 10% off if they use that code. So thank you so much for doing that.
Yes, of course. Yeah.
Hey, thank you so much for being on today. It was a pleasure to talk to you, and I'm glad that you're kind of getting the message out there and helping women realize that there's more to health than there's more to just how you look and more to just how you feel, but we're kind of a whole person, and we need to take care of every part of ourselves. So
amen. And Christina, thank you so much for having me on today and for having this conversation so that we can help spread the word on this.
Yeah, thank you. Hello, my friend, and welcome to another episode. I'm so happy that you're here today. How is your uric acid? I assume you haven't had a chance to get it checked since we talked about it last week, but I do hope that knowing about it empowers you to figure out the root cause of any health changes that you might have now or in the future. Today we have a special episode where we're going to talk about some of the vaginal changes that happen as we age. It's something that doesn't get talked about a whole lot, but there are things that you can do. So I think it's important for you to know maybe this is in your future, maybe it's not, and that there are options. We're going to talk about a specific product. It's not the only option for you, but I think it's so good to know that it's one of the options and kind of expand your mind into thinking about maybe preventing some of the vaginal atrophy and vaginal dryness that can happen with age. So I hope you enjoy this conversation that I had with Lana Kerr. She was so gracious to come on and talk to me for the benefit of all of you about vaginal rejuvenation and just kind of some of the things to think about as we age. Lana is an awesome person and just so kind, and I know this podcast is audio only, but I did record our interview on Zoom, so I have the video of it, and I think it'd be interesting for you to see. I think she told me in the interview that she's 54, and I'm 44, and I think she looks younger than I do. She looks great. She describes herself as a fierce advocate for women's health issues, particularly those that arise with aging and menopause. In 2015, she pioneered a skin rejuvenation method using CO2 Lift, which is a gel that delivers carbon dioxide for regeneration and anti-aging benefits to your skin. Typically, people would put that on their face. We'll get into all of it. She also developed CO2 Lift V for vulva and vaginal rejuvenation, enhancing lubrication and sensitivity. In the past, she's been a wellness company owner of a company called Your Fat Loss Coach, and she had some pretty famous clients. She graduated from the State University of New York, and she really knows her stuff. So let's get into my conversation with her and see what you can learn. Thank you so much for being here today. I hope that conversation kind of helped you think about some of the aging things that maybe you hadn't been thinking about before, and that you have options to prevent or delay some of those vaginal effects, which is awesome. If you do want to look into buying CO2 Lift, her website is co2lift.com. I'll put links in the show notes, and remember you can get 10% off if you use the coupon code Christina10. I don't get anything out of it, but you will if you decide to buy something. Why not get 10% off? She also sent me links to 2 ebooks, so I will put those in the show notes also. So those would be great resources. One is called CO2 Lift Face ebook, so you could read through that, and the other one has an awesome name. It's called Say Yes to Menopause. So I'll put links to both of those ebooks. They're totally free, and also to her website, and I'll list the coupon code in the show notes, so go find those there. Next week, we're going to talk about how up-leveling the way you play can help you age better. Until then, be proactive about your vaginal health and don't be normal.
Thank you so much for tuning into the Health Courage Collective podcast. I am truly honored that you have paid me the enormous compliment of your time and attention. I would be so grateful if you would share this podcast with someone you know and subscribe so you never miss an episode. This podcast is for entertainment and information purposes only. Statements and views on this podcast are not medical advice. This podcast, including Christina Hackett and producers, disclaim responsibility for any possible adverse events by use of information contained herein. If you think you have a medical problem, consult a licensed physician.